Good afternoon, everyone, and welcome to the Implementation and Capacity Building Team, aka Impact session of the ARCFEST. So in this session, Nicola and I are going to present on Impact Roundtables, followed by Collette Miller, who'll be providing an update on the capacity building opportunities available in the ARC. So I'm Nihr, and I'd like to introduce my co-presenter, Nicola Gaskins. We're both senior research assistants in the Impact team based at the University of Central Lancashire. So in this part of the session, we're going to be presenting an introduction to Impact Roundtables, so what they are and what they intend to do. We're providing an example of an Impact Roundtable we've been facilitating over the last 12 months in stroke, and we'll hear perspectives from current members of the ARC Northwest Stroke Impact Roundtable. So what is an Impact Roundtable? An Impact Roundtable intends to bring together a strategic level group of individuals with expertise and/or experience of a particular topic of interest or health condition, for example, stroke, and provides a forum in which these stakeholders are able to collectively share their knowledge and experience of system-wide efforts to implement improvements and interventions in the area of focus across the Northwest Coast. Through discussion and the sharing of successes and challenges in implementation and improvement efforts, it is anticipated that Impact Roundtables will enable the mapping of activities and current practice in the Northwest Coast and will help identify gaps to shape future research and implementation agendas. These collaborative forums aim to reduce duplication of effort, improve understanding of best practice examples, and generate learning of how to implement system-wide change. So Impact Roundtables intend to work within ARC priorities and ARC structures in the following ways. So the focus of an Impact Roundtable needs to be a priority for the local health and care system, so that stakeholders are working together to support improvements in health and service delivery that are relevant to local populations. It is also important that Impact Roundtables involve individuals who have expertise and/or experience of the area of focus. This supports the opportunity for individuals from different settings and different perspectives to collaborate with each other in a way that may not usually outside of their own setting. Member organisations, public advisors and patient representatives need to be collectively involved in co-designing both the focus and the format of an Impact Roundtable from the outset, contributing to decision-making on roles, responsibilities and reviewing representation, and be involved in designing and conducting activities that arise from roundtable conversations. A health equity lens needs to be embedded within all activities of an Impact Roundtable, and any resulting outputs and implementation efforts intend to have a clear focus on contributing to reducing health inequalities in the area of interest. And lastly, one of the main motivations for an Impact Roundtable is to initiate discussions that identify gaps and generate solutions that can be implemented to change service delivery and ultimately improve patient outcomes. It's anticipated that any Impact Roundtable would include representatives from all of the sectors identified in this diagram, so that the knowledge and experience can be shared across different settings and different organisations. We're now going to present an example of an Impact Roundtable we have been facilitating in stroke over the last 12 months. Firstly, Professor Dame Caroline Watkins, the implementation lead for ARC Northwest Coast, is going to tell us why there is a need for a forum of this nature in stroke for the Northwest Coast.
So why have an Impact Roundtable for stroke? Well, stroke is the leading cause of death and disability worldwide. And the Northwest Coast has higher than average incidence and prevalence in the UK. And this is a dreadful thing. And I suppose what's more dreadful is that despite us having really strong evidence of how to prevent, treat, and support the recovery of people after a stroke, a lot of these things aren't implemented in practice and aren't delivered to all of the people all of the time. So there is recognition at a national level that this needs to change, and the National Stroke Plan has been developed and it is to be implemented by the integrated stroke delivery networks. These ISDNs will have to deliver whole systems change and make massive changes. The Stroke Impact Roundtable has been set up to try and complement this. And what it will do is to discuss with key stakeholders how to put together a systematic evaluation and exploration of what is happening as this change moves forwards, and how to understand what works well and what could have been done differently, such that we can share these things with other people when they're changing stroke services, but also to learn from it for other areas as well. So what we're hoping is that it will not only help us understand how to make changes in the short term, but give us an enduring approach for the long term. The Stroke Impact Roundtable, although it's organised by me and the ARC Impact team, is expertly chaired by Prof. Joe Rycroft-Malone from Lancaster, who is a leading light in implementation. And all these groups have been brought together to map out what is happening, how it's happening, and how to understand what is working well and what could be enhanced. It's aimed to be an integrated approach with health and social care working together, but also enhanced by the input of public advisors, patient organisations, NIHR infrastructure like the ARCs and the Clinical Research Network, the Academic Health Science Network, which is our innovation agency, and several other people who are leading clinicians in the area. It's clear we've got an awful lot to learn about working together, and to truly make a difference to people's lives, we have to make a connected research community approach.
Thank you, Hayley, and good afternoon, everyone. I'm Nicola Gaskins, and I've been involved in the setting up and running of the Roundtable in Stroke since the planning stages. As Caroline explained, stroke was identified as a priority for the North West Coast region. So the first thing we did was to approach key individuals who either had expertise in the area of stroke care or improvement or lived experience of stroke to invite them to be part of this first ever roundtable. We created a draft of the aims and the format of the roundtable in terms of how often it would meet, and sent this information through to those who had expressed an interest in being involved. Professor Joe Rycroft-Malone was invited to chair the roundtable, and we set up the group's first meeting, which took place online in May 2020 because of the pandemic. So this worked really well, as it allowed everyone to attend, despite what was going on in the world at the time. Since its launch, the group has together developed the terms of reference, which includes the aims and objectives of the roundtable, as well as role profiles for different members, including our public advisors, professionals, and clinicians. With the ARC's emphasis on addressing health inequalities, the group has conducted a health inequalities assessment, which is the HIAT, to ensure that there is a focus on improving health inequalities within stroke care across the region. So one of the advantages of having all these people together in one room, so to speak, has been the opportunity for them to share knowledge and expertise within the group and develop links with other networks across the region. In turn, this has guided the roundtable's focus and its priorities around improving care and outcomes for people with stroke. One of the areas identified during meetings has been the need to map the research, innovation, and implementation activities which are currently going on across our region, so that the group can identify where there are gaps in these areas and develop plans to address these. So you can see from this diagram the diversity of the organisations represented and involved in the Stroke Roundtable. In terms of ensuring that there is adequate representation from organisations involved in stroke research, innovation and implementation, the group revisits this list regularly. As an example, initially there was no local authority representative, which was identified as a gap, and we're pleased to say that Lancashire County Council are now part of the group. There are representatives from the Health Service, the 2 integrated stroke delivery networks in the North West Coast, members of the public, the NIHR, third sector and universities. So this is a screenshot from one of our meetings, and I think it shows you quite nicely the range of people who are involved in this roundtable. The other thing is I think everybody's smiling. So we also wanted some of our roundtable members just to give you some insight into what it means for them and their organisations to be part of the roundtable. So we're fortunate to have 3 public advisors who are part of the group. They are Alan Pemberton, Bernard Gibbon and Lynn Hedgecoe, each of whom make valuable contributions to the group's discussions and decisions. This is Alan, who's recorded a brief video about being part of the roundtable, and he is speaking on behalf of the 3 public advisors. Oh, sorry, I just need to go back twice.
These are some of the benefits identified by 3 public advisors who have been involved from the outset in the Roundtable project on stroke. Indeed, this early intervention of a public perspective into the research is an important benefit in itself. A simple benefit is that everyone taking part has been alerted to the controlled use of acronyms and the importance of using plain English in all documents. The Roundtable has facilitated discussion and collaboration between researchers, academics, and public representatives, and has demonstrated how everyone is there on an equal footing. Another benefit is the identification of gaps in the care of patients suffering stroke. This will help to prioritise and focus future research. An important benefit has been the opportunity to bring a patient and user perspective to what is a complex clinical condition, and particularly to recognise that stroke brings long-term physical, psychological and social implications. Thank you.
So this is Jen Gardner, who represents the Stroke Association, which is the 3rd sector organisation who supports stroke survivors in their recovery, and she's part of the roundtable as well.
My name is Jen Gardner, and I'm the Associate Director for the Stroke Association in the North West of England. And I'm also a member of the Stroke Impact Roundtable. And I'm just going to share with you some of the benefits that it brings attending the roundtable meetings. So firstly, it enables us to share some of the insights that we're hearing from our research teams in the locality with our national research team, and vice versa, to bring back to the conversation what the national teams are looking at. It also means that we're up to date with the research evidence that can inform our own service delivery for our life after stroke services. So we can use this up-to-date research to provide continuous improvement in the quality of the services we provide. It means that we can bring the voice of lived experience to the table, and also learn from the way in which our local research colleagues interact with patient and public involvement groups. And finally, and probably most importantly, it improves integration and collaboration. There's a number of different stakeholders and organisations involved and at the table. That helps us to build our relationships and work as a collaborative team, from prevention through to life after stroke services, all working for a shared goal of improving care, treatment and outcomes for stroke survivors and their carers.
And this is our last video. So this is Kaiser Chatterjee, who works at the Countess of Chester Hospital as a stroke consultant. And he's part of the Cheshire and Mersey Integrated Stroke Delivery Network. He also represents the Clinical Research Network at the Roundtable.
When the proposal to start the Stroke Roundtable came up, I was interested but somewhat skeptical on the usefulness of having another group. What are we going to achieve with another group? But after the second meeting, it became clear where the gaps between the research and services were and how the roundtable was going to plug some of them. I was initially involved in representing Northwest Coast CRN, but with my ISD and deputy lead hat on, I probably represent both these organizations. I'm a clinician first and a researcher after that. So I suppose the Stroke Roundtable, which sits on both sides, is an ideal platform for me. When this group matures, I strongly believe it will be helpful for both the organizations I'm currently representing. Thank you, Caroline, for giving me the opportunity to join the group.
So the roundtable meetings are continuing. The group is working to create a map of the research, innovation and implementation activities that are taking place across the region. This will help us to identify any gaps so we can develop plans to fill in the gaps and also reduce duplication of effort, as well as encouraging individuals and organisations to work together. It's also exploring how to achieve a whole system change across the complex stroke pathway, whilst delivering the same quality of care to all people who need it. Other discussions have been around ways to collect the right information to measure how changes in the way stroke services are delivered impacts on patients' experience and their outcomes over a longer period of time. The Stroke Impact Roundtable is the first one of its kind, and we're developing a framework for use in setting up other roundtables. So now that you've heard from current members about the benefits of being involved in a group such as this, we'd really appreciate it if you could reflect on whether there are other areas which might benefit from a roundtable. If you have any thoughts on this, please can you either pop it in the chat now or email one of us on any of these email addresses afterwards, and we will get back to you. Thank you all for listening. We have time for just a couple of questions, I think, before Collette speaks to you about capacity building. Hayley, I don't know if we've had any questions or anything, because I can't see that bit.
Yeah, we've just had a couple of comments around other people that could be involved in the stroke roundtable. So we'll get in touch with Gabby and Selena around that. But apart from that, no other questions.
Okay, thank you. So there's nothing more. Collette, should we move on to you?
We can, yes.
Cool, yeah.
Okay, hi everybody, I am Collette Miller and I'm the Research Capacity Delivery Manager for the ARC Northwest Coast, a role which I share with George Georgiou, who many of you will know from his time not only in the ARC but also in Clark, who's on holiday today. And I've been asked to speak to you about some of the capacity building initiatives that are going on currently within the ARC Northwest Coast. Next slide please, Nicola. And as I'm sure you're all aware, part of the aims of the ARC capacity building is that we try to develop a culture of research, innovation, implementation at individual, at organisational and at systems level, with the ideas of kind of sharing knowledge, skills, coaching, etc. And one of the main focuses of the first 2 years of the ARC has been the recruitment of our PhD students or ARC Northwest Coast Doctoral Fellows. In December, we recruited a further 13 students who commenced their studies on the 1st of February, which brought our total up to 22. And as you can see, we have a really good spread. We were really pleased to include Edge Hill and John Moores as part of this cohort now. And the students are all working to undertake research that will improve health outcomes and address health inequalities, preferably within the Northwest Coast region and also with generalisability across the UK as well, and hopefully wider reaching. You will have seen some of the wonderful presentations that they've done as part of the theme meetings, and you will see more of the students as their projects progress throughout the remainder of the ARC. Next slide please, Nicola. We are currently recruiting to another round of studentships. We have a couple of places left at UCLan and Lancaster. The deadline for those applications closed on Sunday, and currently the ARC academics are in the process of shortlisting to identify suitable candidates for interviews, which will be taking place in July. And we're hoping that those students will commence on the 1st of September 2021, at which point we hope to have a full complement of PhD students as part of the ARC Northwest Coast Doctoral Fellowship Network, and myself and George and any other people within the ARC will continue to support them with both pastoral and training throughout their journeys as PhD students. Next slide please, Nicola. Another really key part of the capacity building initiatives of the ARC has been the internships, which many of you will have seen. I heard Jane Nihr speaking earlier, and we are currently accepting applications for internships. So if you're interested, the closing date is July the 12th. We have a number of different opportunities available at the moment, which include data science. So these must relate to existing data and sit under one of the ARC themes, which the ARC themes applies to all of these things. Rapid evidence conversion summaries. So this is where if you are someone working within a member organisation and you have an established interest in research, an area that you're particularly interested in and an idea of the literature, you can look at undertaking an implementation and evaluation as part of this and developing your own races. Finally, we have the NIHR Fellowship Development Scheme, which supports you to buy out a little bit of your time just to spend time thinking about what kind of research career you might want and what kind of project, and build a team to support you in the development of an application for a fellowship. And we've had numerous successes in the past with developing these for pre-doctoral and doctoral, etc. If you have any questions about these, as I stated earlier, they are open to members, staff working in member organisations. Please contact us at ARC North West Coast and we can send over the information, or if you want to discuss your project, etc., that's great. And next slide, please, Nicola. And finally, we are also involved in the development of an NIHR event around making implementation happen through capacity and capability building. So this is a virtual collaborative learning event. Many of you will have been aware that this was initially supposed to take place face-to-face in Liverpool in March last year, but it has been delayed due to obvious reasons. It will now take place on the 21st of September virtually, and the focus of the event is sharing learning about implementation and evaluation and finding out what are the barriers and facilitators to adoption and scaling up of effective interventions, particularly with a focus on public health and social care and how the two can work together to kind of break down barriers and make more effective ways of working. So again, if you wanted to register for this, the information is in the link that's in the slides, and we can also post it in the chat. And that is everything that I was going to discuss with everyone today, but if you've got any questions, I'm happy to answer them. I can't see any questions in the chat. Thank you, Neil. Okay, should we, is there something else that we would like to discuss at all during this time? I think, have we got 5 minutes, 7 minutes before the next session? Thank you, Koza. You're welcome.
I mean, it might be quite helpful to know if anybody feels that there should be any other internship opportunities. Perhaps if anybody has any other ideas for different levels of interns.
Always useful to get people's feedback. Oh, are there any plans for capacity building with public advisors?
What capacity building would you like?
Hi, Caroline. It was just a general question, really. I mean, I was just thinking whether that would be done through the public involvement theme anyway, but I just wondered if there was anything around, anything in the pipeline, because I think there was a survey previously that was undertaken. So I wasn't sure.
Yeah, the survey was done by the Midas team. They were looking at training needs, and they have set up some groups. I know Alison Doherty's on the call. I don't know whether she would want to say something about the training needs survey?
Hello, training needs survey. Yeah, we undertook a training needs survey in September last year. We had about 21 people respond. I don't think we got a great response from public advisors, but we've now started to put together some resources linked to the needs that people identified, and those resources are on the MyDAS web pages. We have got some plans in terms of involving public advisors in our races project, but we're going to talk about that just in the next session. So I don't know if that answers your question.
No, thank you. That's great. Thank you both.
Yes, I mean, I guess the other thing is that we would like public advisors to be involved in some of the internships and some of the implementation work. And I guess we have public advisors already involved in the Impact Roundtable. But I don't know if Nihl and Irma on the call wanted to comment on public advisory involvement in implementation work. Are they here?
Nihl actually has put up a question in the chat asking which topic areas of research would suit itself to an impact round table.
Thanks, Karen.
Yeah, so I suppose, I mean, anything potentially could have a round table. I guess it needs to be a big ticket item where there is both clinical service developments and research going on, where we need to make sure that the two are linked, because sometimes they live in separate realities, and they need to be brothers in arms, really. Thought that might appeal to Nihl. The setting of the sun. Nihl, did you want to say something?
Sorry, just I think Nihl might be having technical difficulties, Caroline.
All right.
I am, but I'm not too sure if anybody can hear me, Caroline.
Yeah, we can hear you.
Oh, wow, wonderful. Yeah, and that was just to, even though it's early days, I just wanted to comment on your observations about public advisors as co-theme leads. I think it's a massive progressive step for ARC and for, you know, the ethos of public involvement to have such faith in members of the public. And I'm really looking forward to exploring the ideas of when you say big ticket research projects. I completely understand, Caroline, but I think from what we've heard and seen today in many of the themes, impacts work as a cross-cutting theme could adopt so many of this wonderful work. I've recently been involved in the air quality projects with Hayley and Fiona, and again, it's such a ubiquitous issue, and it'd be great to see further work with that, and I'm really looking forward to my work with Impact. Thanks, Caroline.
Okay, great.
I suppose it's also worth adding that all of the PhD students have public advisors involved in the development and design of all of their projects, and the same goes for the interns as well. So there is always a public advisor input into all of the initiatives that we've been talking about.
Yes, and I hope that we aim for real involvement. I know somebody earlier was saying that sometimes it's about, you know, with PPI or public advisory involvement is more a sanctioning of what academics want to do. But I think that the whole agenda with implementation is obviously there's an academic slant to it, But the whole idea is that we improve the quality of care, improve outcomes in areas that are very important to the communities that we're working with, and how to understand whether things are really making a difference to the things that people want to make a difference to. We need to get that insight from public advisors and the public.
I think we might be out of time now.
I think we are.
Yeah.
Okay.
Thank you, everybody.